Hello everyone, welcome to the Open Circle. It's a Leprosy Mission Trust India initiative which is supported by the Rotary Club. The Open Circle, as the name suggests, it's an inclusive space where we have conversations that nudge people to think differently and deeply. It's a space where we listen, where we learn, and where we discover the collective wisdom of people. And we're going to do the same thing. We're going to learn, we're going to listen from a very special guest today, which is Dr. Anil Kumar. He is currently the principal advisor at the National Center for Disease Control, Government of India. Prior to this, he was the Deputy Director General at the Central Leprosy Division, Ministry of Health and Family Welfare. So, welcome, Dr. Anil Kumar, sir.
Thank you.
First, tell me, how have you been? How are you?
I'm good.
Great. It's really good to have you on the show. Now, before we begin talking about leprosy, could you just take us through your journey with the leprosy disease and your experience of the leprosy disease, and how did you come to associate with this program of leprosy?
So, I was posted at Central Health Education Bureau initially, and I was heading editorial division. So, at that time I used to write different articles on different disease. And what attracted me, that the suffering of people due to leprosy. So I started writing articles on leprosy in one journal called Swasthin, which was very popular at that point of time. Almost all public health experts, different medical colleges, they were subscribing to this journal. So I wrote many articles related to leprosy at that point of time. It was during 90s. After that, I worked at different places. I was also working at Singur, which is a center of All India Institute of Hygiene and Public Health. So I was heading that center. So there also I saw many leprosy cases. But my interest developed when I became DDG leprosy in the year 2015. So to start with, as a national program manager, I traveled throughout the country to understand the problem related to leprosy. And what I observed, that people are suffering. You see a girl of 13 years having leprosy with disability. So you can understand she is poor, she is not educated, and she is a girl, and she is living in a village. So you can understand this amount of suffering she is going to have rest of her life. In leprosy, you do not have mortality. People do not die of leprosy, but they suffer. And this is much more, because if somebody is dying, then suffering is over. But if you are having disability and you have stigma attached with the leprosy, and you are dealing with that stigma in day-to-day life, it's a suffering. So that is how my interest developed in leprosy, and then 2015 onward, I'm regularly working for leprosy program.
Great. I understand the pathos that you have felt while visiting those places. Now, the natural question that comes to my mind is, we call leprosy the oldest disease known to mankind. But in 2025, why are we still talking about eradicating leprosy? Why haven't we done it yet? We did get rid of smallpox, polio, and other diseases back in the 80s and few years ago also. And we're also on the verge of, I think, eliminating Kala Azar and also. Why do you think we have not been able to eradicate leprosy?
Leprosy is a different type of disease. It has very different epidemiology. First of all, the incubation period is very, very long. I mean, the average incubation period is 6 years, and sometimes it may extend to even 20 years.
When you say incubation period, what does it mean?
So, incubation period is something when a person is exposed to the organism which cause the disease, and when disease is surfaced, when we are able to recognize that person is suffering from disease because of some clinical signs and symptoms. So that is the incubation period. So it takes 6 months. If somebody is exposed to disease now, so on an average, it may take 6 years to know that person is having disease. So it's a very, very long time. People will, continue to harbor disease for very long time. The second reason is even after when person is having disease, he doesn't have, the sign and symptom like, for which there is an emergency that he will go to hospital, because there may be a patch on the back or, somewhere. And then, person is all right. He is not having fever, he is not having pain. So he will not go to the hospital. The person may be, going to the for some work. So work is more important because he is not having any problem. So he will continue to have that disease with mild signs and symptoms, like I said, patches, and then he will not go. But he will continue to, transmit the disease to others. Of course, the leprosy is not a disease which is, transmitted very easily. But for leprosy to be transmitted to other person, you need very close contact for longer period of time. But still, he is transmitting the disease to others. So that is the reason, because to control the disease, we cannot wait for him to come to the health center or hospital. We have to go to the village or to his house to find the cases. And that is very, very important. So we have to work very, very hard to detect cases and control the disease. So this is the reason why we are still having leprosy disease in our country. It's unfortunate, but it will take time when we will be able to eradicate or get rid of leprosy or make the India leprosy free.
So there are 2 points emerging from what you said, sir. One is a long incubation period from the time the bacteria enters the body till the time the manifestation happens. And the second is that the early signs and symptoms are not scary or painful enough for that person to act upon it and go for screening and diagnosis. Now, when you were heading the Central Leprosy Division, starting 2015, you have been heading that organization. What changes or what additions did you bring to that program to somewhat offset these disadvantages that we have?
So first of all, I would like to tell you that I got very good support from everybody, from the ministry at that point of time, the Director General of Health Services, and different states. So that is why I could implement many initiatives in the program, like leprosy case detection campaign, which is the best ever campaign, not only in India but in the world. Because why it is best? Because our people, ASHA, and our workers, they are going to each and every house, and they are examining each and every person in the house, and then they are detecting cases. So this is the best which we can do. So almost 25% of the population in India was initially screened by ASHA worker and the male volunteer, and we detected cases very, very early. So this is one initiative, leprosy case detection campaign. Then there were many other initiatives like Spurs leprosy awareness campaign, where we involve the village panchayat to educate the community with the support of our ASHA, with school teachers and others in the village. So when village panchayat is giving some message to the community, it is very, very effective message. The message was related to that any case of leprosy, when you find, and there are certain signs and symptoms which you can recognize at village level, so you refer the case to the primary health center, and then do not discriminate against discriminate the person having leprosy. Even we advise them, and many of the panchayat implemented that if you have a case of leprosy in the community, you just felicitate the person, so that it gives a good message to the community. So this was Spurs leprosy awareness campaign was very effective, and it was conducted in almost 70% of the villages in our country.
70% of the villages in our country?
Yes. And then we had focus leprosy campaign, where you are not having leprosy case detection campaign. Then there was a special plan for hard to reach area. And it was also, started that each and every case of grade 2 disability should be investigated why case has occurred. What was the reason? So that you can correct, take the corrective measures in the program. So these are, some of the initiative taken during my time, and also the chemoprophylaxis. The rifampicin chemoprophylaxis, India is the first country where we started the chemoprophylaxis, rifampicin chemoprophylaxis for leprosy cases.
So, what does chemoprophylaxis mean?
So chemoprophylaxis means we give some drug to the person who we suspect that he is harboring the infection. So when we give, the drug kills the Mycobacterium leprae responsible for occurrence of leprosy. And that is how we are able to prevent, because it's very early stage. Person is not having the disease. So we have killed the Mycobacterium leprae, and that is why we are able to prevent the leprosy in those cases who are not cases, but they are contacts, and we suspect that they are probably harboring the infection. So that was an initiative taken. India is the first country where we started this, even before the recommendation from WHO came. Now, of course, recommendation from WHO has come, and everywhere, almost all countries where we are having leprosy, they are implementing this.
It's an important prevention tool, according to you.
It's an important prevention tool.
Yeah. Sir, it's good to know that under Sparsh awareness campaign, we could mobilize the local influencers, like you said, Panchayat Pradhan and all.
Yes.
That's very good. Now, my question is, when you say leprosy case detection campaign and Sparsh leprosy awareness campaign, do they happen simultaneously in the same areas, or how do you decide where the awareness campaign and where the leprosy case detection campaign would happen this time?
Leprosy case detection campaign was conducted where we suspect that there is transmission of leprosy going on, where cases are more. So, and the criteria which we decided at that point of time, that the percentage of grade 2 disability cases. Grade 2 disability means the visible deformity. So wherever percentage of grade 2 disability among new cases is more, it means transmission is going on there. So those were the priority areas where we conducted leprosy case detection campaign. Sparsh leprosy awareness campaign, there may or may not be leprosy as of today in a particular area, but there may be past cases with disability or otherwise. So discrimination can happen anywhere in the country. People from the endemic area or high endemic area, they can travel to non-endemic area in the country where there is no leprosy now. So discrimination can occur there also. So our target for leprosy, Sparsh leprosy awareness campaign was all the villages and urban areas in the country. So it means everywhere it was conducted. And that gave very strong message to the community.
Excellent, excellent. So what you were essentially saying, sir, is that to combat this disease, on the one hand, we have to increase the level of awareness and reduce the level of stigma in the community about leprosy that they have. And on the other hand, we have to take proactive steps in terms of identifying eligible people for giving that rifampicin that you mentioned, that prophylaxis preventive tool. That's you marry these two and you are able to make some progress, right?
Yeah, see, the idea at that point of time was that this is a disease which is, people have discrimination because of this disease, and also disability. The people suffer, and also that was impacting the country's GDP also, because they do not have that productive life anymore, and even we have to spend lot of resources for all those persons. So idea was to bring down prevalence of leprosy as early as possible. So we tried whatever is possible technically in public health. We tried that. So all this, whatever as you mentioned, that Sparsh leprosy awareness campaign or leprosy case detection campaign or other initiative, we took almost 1 dozen initiative at that point of time. to reduce the prevalence of leprosy in the country ultimately. Although, as I said, that this we must understand that when we take action in leprosy, because it has long incubation period, if we are taking initiative today, it takes time, maybe 6 years or more, to actually have the impact of that particular initiative. So immediately we will not see the impact. That we must understand. So, but we did that, and large number of disability due to leprosy were prevented. We have data available with us. It says that all those initiatives taken during those 3-4 years, large number of disability in the country were prevented. So that was the ultimately outcome of all those initiatives which we took.
Excellent. Sir, I want to understand what is the link between leprosy and disability. You mentioned grade 2 disability and visible deformities, but it's a bacterial infection, right? And so you said it happens when you see patches, you identify leprosy. But what has it got to do with disability?
See, the thing is that leprosy generally start with some sort of mild symptoms, as I said, patches, and there are other symptoms also. I will not go into that detail now. There may be some cases, very limited number of cases, which can occur, which can lead to disability very early. But normally, there will be mild symptoms like patches, no fever, no pain, and then person continue to have the disease, and then disease will continue to spread, and then it will impact our nervous system ultimately, and then it may cause the disability. That is the cause of disability, because nerves are responsible for our muscles to function. And if there is something, some disease is there which is causing any issues with the nerves, then it may lead to the disability.
So am I correct in understanding that if you are delaying on your diagnosis, then there is a risk of getting disability? Otherwise, if you go for early diagnosis, then the chances of you developing deformities are less.
Less, definitely less. And whatever I am explaining to you, it's very simple, and I am not going into all those medical jargon, so that people can understand.
Right. So now, if you look at today, we are sitting in 2025. If you go back 10 years, 20 years, if you trace backward, and your introduction to leprosy and your initial work, what do you think in terms of progress that we have made in the last 20, 30 odd years from where it was and where it is now?
See, I will like to tell you something. We often talk about India reporting maximum number of, the largest number of cases are reported from India. This is what we understand. Whenever we go through any literature, we find that India is reporting largest number of cases in the world. This is what is the understanding which we have. But what we do not understand that because of our good surveillance system which we have, large number of cases are reported. But if you look at the disability which India is reporting, as compared to cases, it is much less. So it means the number of cases which India is reporting, it is because of the good surveillance system. If we compare with other countries, they are reporting more grade 2 disability. It means they are not detecting the cases early, and that is why their prevalence is lower. Now, I am not saying India's population is also more, so if we are having leprosy, so we are likely to report more cases. But this is one criteria, that we have a good surveillance system, because in leprosy, what is the mantra of getting rid of leprosy? That you detect cases early, and this is what we are doing. We are detecting cases early, which is which you can understand by if you analyze the data from India. So this is a good development. In fact, India achieved elimination in 2005. Elimination means, it doesn't mean that India is leprosy free, but we worked very hard at that point of time, and we achieved less than 1 case per 10,000 population, which is elimination level. So India has progressed. Now again, National Leprosy Eradication Program is doing very good work. So and because of Sparse Leprosy Awareness Campaign and all those activities, now discrimination has gone down. Even in villages. I give you one example. I was in a village, either in Andhra Pradesh or Telangana, I don't remember that. I was in that particular village. There was some function in the village. And then what I found, that a lady from the village on loudspeaker, she was, during the function, she was telling her story, how she got the disease, how disease was diagnosed, how it was treated. In a village, a lady is saying so. So it means definitely discrimination has gone down, and that is why, she was able to explain each and everything
Nice.
to everybody. So discrimination has definitely gone down, although people may say that it is not, but if you go to village, you find that discrimination definitely has gone down, and our surveillance system has improved. So because of that, leprosy is not being considered as such a disease which is not curable, which was being considered during early days, even after treatment was available. So people understand that, understanding of people has definitely improved about the leprosy, and that is what take us to ultimately making the India free of leprosy. So we are definitely moving in right direction, but as I said, that it will take time because it has long incubation period.
Yeah. Sir, I want to pick up on what you said about surveillance. Now, I want to understand, where does this surveillance, at what point of time does this surveillance kicks in? Is it when, for example, I am a beneficiary of the Sparse awareness campaign, I became informed about the disease, and whenever there was an LCDC leprosy cessation campaign, I got myself screened and diagnosed and got treated. I started getting treatment. In this process, where does surveillance kick in?
See, the thing is, when we are talking about surveillance, we are not talking about the individual case. We are talking about the community, the cases reported from the community, then data about the cases is analyzed, and then you take action. So this is what. So surveillance was there, even 20 years back, 30 years back, 40. Surveillance is always there. The idea is, at our surveillance system, at what level cases are detected. If cases are detected late, then more and more disability cases will be reported. And when cases are reported late, then these cases will be transmitting disease to others. So this will continue for a long time. Cases will not go down. When cases will go down, when we start detecting cases early, so that we give them treatment, they do not have disability, and also they are not able to, they do not transmit disease to others. So if we continue a high quality surveillance, means detecting cases very early, preventing disability, and if we continue for very long time, then leprosy will go. And this is what we are right now we are doing. We are trying to detect cases very, very early. And if we continue like this, ultimately India will be free of leprosy. This is the mantra. All other things will support. I mean, chemoprophylaxis and everything will support, so that we can move in that particular direction. So surveillance is this, that you collect data, you analyze data. Data should be analyzed very effectively. That is very, very important. And based on data, you will understand where you have the problem, where we have more cases, so that we can take action accordingly. Whatever resources we have with us, we will be able to use our resources very effectively. This is the benefit of surveillance.
Thank you for explaining that, sir. Now, you have your hands deep into that program for a quite long time. Now, if we look at our target of eradicating the disease in the coming years, what do you think would be the top 3-4 priorities that India should be focusing on?
First of all, regarding leprosy eradication, I would like to tell you something. as leprosy is having very long incubation period, it will be very, very difficult for us to, eradicate the leprosy in present time. When we will be able to eradicate leprosy, that will be in past. That last case of leprosy occurred, 20 years back. Because, present time, immediately we will not know, because 20 years long incubation period. Maybe, now no leprosy cases are occurring, maybe after 20 years, one case has occurred. So, this we have to understand that leprosy eradication is something else. We should be talking about more of, making India leprosy free. And before making India leprosy free, we have to talk about the zero transmission of leprosy. So, we have to first achieve zero transmission of leprosy. Zero transmission of leprosy means leprosy cases are there, but these cases are not transmitting disease to others. First of all, we have to achieve that status. Once we achieve that status, and we will be able to, give treatment to all those existing cases. And we wait for, those harboring infection, we detect them early and treat them also, so that no transmission can take place. So that is the status of zero transmission. And if we maintain this status, then we will achieve leprosy free India, and then we will ultimately say, after waiting for long period of time, we will be able to say that leprosy is eradicated. This is how things will move. So eradication, something is we normally we do not talk in technical. I am talking about technical terms.
What do you think should be the priorities that India should focus on if we go towards zero transmission, if we want to move or accelerate the progress towards zero transmission?
So, National Leprosy Eradication Program, they are already taking appropriate action at their level. They consult experts, national level experts, when they take decision, and as per the government policy, decisions are taken. So I understand. I think and this is true also, that they will be taking appropriate action and they will move forward. So how we can get the most important thing in leprosy is that you detect cases early as possible, and treat them. As I said earlier also, it's a mantra that you detect cases early and treat them. Now to achieve that cases are being detected early, we have to take some appropriate measures. First of all, we need to use the advanced tools and technique in public health. Now we have development in each and every area of medical science and public health also. So in public health, we are having now better tools available, like we have the GIS based analysis, we have the molecular epidemiology techniques, we have mathematical modeling. Now AI has also come. So these are some of the tools, and these tools need to be used effectively, so that we can achieve what we want to achieve under the program, like early case detection, or the chemoprophylaxis, or the awareness, like sparse leprosy awareness. We can have better system of making the people aware. So all those things, whatever advancement taking place in public health, should be used so that we can achieve leprosy free India as early as possible.
So we got to know from you about the different initiatives that the National Leprosy Eradication Program has taken, and it still continues with those initiatives. Now, if we look at general community and public at large, how can we support the Leprosy Eradication Program and the government in achieving leprosy-free India?
First of all, I think we need to understand the various activities which are conducted under National Leprosy Eradication Program. So we need to understand the program, so that we we can support the program. This is one thing, because once we understand, we can support the program. But as general community, first of all, we have to we have to create an environment where people do not discriminate against leprosy affected person. We must understand that leprosy is like any other disease. It's not there were many misconceptions during earlier days about leprosy. So we have to get rid of all those misconceptions, and we must be we must understand that it's like any other disease. Second important thing is, once we achieve this discrimination part, is that anywhere we find a case of leprosy or we suspect a case of leprosy, we must motivate that person to go to nearest primary health center or any other hospital or any other place wherever they can get the treatment, so that cases can be detected early, and people the person do not transmit the disease to anybody else. So this is what we need to do. Second is, one more important thing is that in our country, there are many people who are suffering, still suffering because they had disability long time back. So they are suffering. They are not able to earn effectively. So we need to support those people also, so that they start earning at a community, like we can generate some sort of employment for them at the community level. We can start that type of activity, so that they have a good quality of life and they can
Yes.
contribute in India's development. Now we want to achieve Viksit Bharat by 2047. So with the support of everybody, whether leprosy affected person, whether disabled or not, everybody should contribute. So we have to create an environment at community level, so that they can effectively contribute in development of the country. This is what we understand, and it's good for all of us.
Yeah, it makes a lot of sense, sir. Thank you. Thank you for spelling that out for us. My next question would be, I recall you mentioning that India has the largest burden of leprosy in the world. Also, it has the highest, almost second highest or highest population in the world. Now, despite that, you said that because of the initiatives that we have been taking for all these years, we have been able to somehow contain the transmission of the disease and bring the prevalence rate down. So, what is it that you think the other endemic countries can learn from what we have implemented on the ground? Other countries, I'm sure leprosy is endemic in other countries as well. How can they take a few lessons from what we are doing?
So as I said that early case detection and treatment, that is very, very important. The type of surveillance system India is having. Of course, in India, we are supported by the very good quality infrastructure which we have. We have ASHA at the village level, then we have sub-center, we have primary health center, we have district hospital and the tertiary care hospitals. So other countries, they must also understand, they must also learn from India how we can develop this type of surveillance system, the good surveillance system where we are detecting cases very, very early, and how despite of the fact that the largest number of cases are reported by India, our number of disability is much less. So they must learn from us, and if everybody in the world, they start following what India is doing, then we can make the world also leprosy free, not in very distant future. This is what I can understand, and there are many things. The number of initiatives taken by us during last 10 years, I think it's a tremendous achievement by India, and I think we also need to tell them, because they should also be benefited what we are doing. Country like Brazil, Indonesia, they must learn from us. This is what I understand.
Yes. So in crux, what you are saying is that having a good health system at a hyper-local level is very, very crucial, be it ASHAs, be it sub-centers or primary healthcare systems. It's very important to have that system in place where people can go to in case they feel the need for getting diagnosed or treatment.
No, what I'm saying, the infrastructure, we have developed infrastructure, and we are working to develop this infrastructure for a very long time. You cannot develop infrastructure overnight. So what I'm trying to say that infrastructure may be developed simultaneously, but the campaign like leprosy case detection campaign, focused leprosy campaign, and the special plan for hard to reach area, these are the things they can implement as early as possible, so that they can start detecting cases very early, and bring down the disability due to leprosy. This you can do as early as possible.
So on a parting note, sir, just one question I have. If I am an individual living in a hard to reach area and somehow I am able to suspect that there are certain signs that I am seeing and I must get myself diagnosed. If I have leprosy in mind, that it could be leprosy, where should I go first? What should be the first point of contact for me?
See, hard to reach area means, where, it is difficult to provide healthcare delivery services. This is the hard to reach area. And in those hard to reach area, we try to take the support of the local people. So there must be some, if ASHA is not there, suppose in one hard to reach area, ASHA is not there, or the sub center is quite far, then they can go to the some local person. With the support of local person, they can send the message through panchayat. They can also send the message to the health center that here we have a person having leprosy, so that services can be provided to that particular person. So local people, the teachers, the panchayat people, they can support this particular person in a hard to reach area.
Thank you. Thank you so much, sir, for all those insights that you shared with us. It's really, I am going back a lot more nourished in the sense of knowledge that I have gathered from you, sir. And thank you so much for coming to our show and taking out time and doing this. We really, really appreciate this.
You are most welcome, and I'm always there to support any activity in our country, so which can help leprosy affected person and which can bring down the prevalence of leprosy in our country. Thank you very much for inviting me.
That is very assuring, sir. That is very assuring. Thanks to you, the audience, for being with us through this show, and we hope to bring you many such conversations at the Open Circle, because it's an inclusive space which is meant for having such conversations which will nudge us to think differently and deeply. Thank you.